Welcome back to Singapore Tonight. More now on our top story. Singapore has reviewed its COVID-19 response, laying out the hits and misses and the lessons learnt. Now, all this with an eye on the future so that the country is better prepared for the next pandemic. We're joined now by Professor Leo Yee Sin, Executive Director of the National Centre for Infectious Diseases. Good evening, Professor Leo. First off, the white paper talked about building up public healthcare expertise and resources as well. What kinds of competencies, programs perhaps, do we need to put in place before we're hit with a future pandemic, and perhaps systems that we don't already have in place?
Well, I think we have learned a lot from the COVID-19 pandemic. And the Singapore systems, in fact, has been able to respond very well in terms of how we handle the situations. But I think there's always lessons learned that we can continue to strengthen and improve on it. I will just, first of all, touch on surveillance, because I think this is the most important first step for us to be able to detect should there be any alert or signal coming our way. And to really have a good surveillance system and continue to strengthen on it, a few things that we can look into. Number one would be the connectivities with the regions and globally and internationally, to be able to have a few things that we have to put in place that is hand in hand with surveillance. Number one will be diagnostic capability. Two will be data management. How can we collect the information as quickly as possible to be able to analyze it as quickly as possible and make sense out of it. Now, to have all these things, putting it all together, we need good people. That is pretty much human capital. We need to develop good people with good expertise that we can have all these things done together, and having this kind of information exchange within the region as well as internationally. I think this will be the most important first step. Following surveillance, of course, if we detect any of the unusual signals, something that we need to respond, then we need to be able to put together a good response plan. And I think this part of it we can continue to strengthen, because COVID-19 is really, it is a global scale and is so big, it's a large scale kind of outbreak. And we really need to pull together all the national resources to be able to work hand in hand together. So it's not just one particular center, it's not just NCID alone that's able to handle. We need to mobilize the entire healthcare system, right from the primary care to the private, public, putting all this together hand in hand to be able to overcome this kind of big-scale challenges.
Professor Leo, you mentioned human capital and the need to mobilize the human resources that we do have. Of course, in the midst of a crisis, by then it's too late to do these things. But post-crisis, such as now, the sense of urgency is not there. How can we build the right kind of human capital when we do not, at this point, have the kind of urgency that we had during the pandemic?
There's always a starting point. I must say that we do have the capability and expertise, but we need to improve on it in terms of having more of people being trained in the various aspects. Perhaps just one.
Apologize for that loss of sound as freezing of the picture as well with Professor Leo Yee Sin. She's the Executive Director of the National Centre for Infectious Diseases. She was speaking to us earlier on the white paper released by the Singapore government.